welcome back to Agape Vlogs. This is NMC CBT Part 1 Test. Friends, before going to the questionnaire, let's all warm up. Let's all join together to congratulate Basil Sabu Abraham, who has cleared his CBT in June 2020. He's from Kerala, India. So, congratulations once again, Basil, and thank you for being courteous to come back to Agape Vlogs and share your success, and also a thank you for sharing your picture. Congratulations to Miss Jesna Rose from Kerala, India. She has also cleared a CBT in June 2020, and I also remember her to be a wonderful subscriber of mine who used to come back after each vlog and tell that she has got the full score for that particular vlog. Congratulations again. Congratulations to Tawfiq Mustafa from Nigeria, who has cleared CBT in June. As usual, let me remind you to mark down your scores. And moving on to the first question, why should healthcare professionals take extra care when washing and drying an elderly patient's skin? The options are option A, as the older generation deserve more respect and tender loving care, that is TLC, tender loving care. And option B is, as the skin of an elderly person has reduced blood supply, is thinner, less elastic, and has less natural oil. This means the skin is less resistant to shearing forces and wound healing can be delayed. Option 3, all elderly people lose dexterity and struggle to wash effectively, so they need support with personal hygiene. Option 4, as elderly people cannot reach all areas of the body, it is essential to ensure all body areas are washed well so that the colonization of gram-positive and negative microorganisms on the skin is avoided. So what is the right answer? Right answer is option B. That is, as the skin of the elderly person has reduced blood supply, it is thinner, less elastic, and has less natural oil. This means that the skin is less resistant to shearing forces and wound healing can be delayed. So that is the reason why healthcare professionals are supposed to take extra care when washing and drying an elderly patient's skin. Got it? Question number 2. What would you do if a patient with diabetes and peripheral neuropathy requires assistance cutting his toenails? Option A, document clearly the reason for not cutting his toenails and refer him to a chiropodist. Option B, document clearly the reason for not cutting his nails and ask the ward sister to do it. Option C, have a go, and if you run into trouble, stop and refer to the chiropodist. Option D, speak to the patient's GP to ask for referral to the chiropodist, but make a start while the patient is in hospital. So, mind you, what are you going to do if the patient who is a diabetic and with peripheral neuropathy requires your assistance to cut his toenails? Definitely the answer is going to be option A. You should document clearly the reason for not cutting his toenails and refer him to a chiropodist. That's the right too. Okay, got me? Guys, these questions are all important ones, though it doesn't seem to be. So be very careful in answering these. Question number 3. A patient is agitated and is unable to settle. She is also finding it difficult to sleep, reporting that she is in pain. What would you do at this point? Option A. Ask her to score her pain, describe its intensity, duration, the site, any relieving measures, and what makes it worse. Looking for non-verbal clues so you can determine the appropriate method of pain management. And option B is give her some sedatives so she goes to sleep. Option C is calculate a pain score, suggests that she takes deep breaths, reposition her pillows, return in 5 minutes to gain a comparative pain score. And option D is give her any analgesia she is due. If she hasn't any, contact the doctor to get some prescribed. Also give her a warm milky drink and reposition her pillows. Document your action. So what are you going to do in this case? you should definitely ask the patient the score of a pain, that is it 1 out of 10, 5 out of 10, 9 out of 10, so that you can understand the intensity of the pain, and also ask the duration, the site, and is there any relieving factors or what triggers the pain, and so you can determine the appropriate method of pain management. So option. Now let's move on to the fourth question. On which step of the WHO analgesic ladder would you place tramadol and codeine? Option A, step 1, non-opioid drugs. Option B, step 2, opioids for mild to moderate pain. And option C, step 3, opioids for moderate to severe pain. And option D is herbal medicine. So which one is the right answer? Option B, that is step 2, opioids for mild to moderate pain, is the right option. Hope all of you got it right. Question number 5. Your patient has a bulky esophageal tumor and is waiting for surgery. When he tries to eat, food gets stuck and gives him heartburn. What is the most likely route that will be chosen to provide him with the nutritional support he needs? Options are option A, nasogastric tube feeding, option B, feeding via a percutaneous endoscopic gastrostomy, that is PEG tube, and option C is feeding via a radiologically inserted gastrostomy, that is RIG, and option D is continue oral food. So what are you going to do? Option C is the right answer, feeding via a radiologically inserted gastrostomy, or RIG, RIG is the right answer. Got me? So let's move on to the sixth question. We are rather going fast because the questions seem to be simple and but equally important ones. What is the best way to prevent a patient who is receiving an enteral feed after aspirating? So the options are lie them flat. Option B, sit them at least at a 45-degree angle. Option C, tell them to lie on their side. And option D, check their oxygen saturations. Option B, sit them at least at a 45-degree angle is the right answer. Moving on to question number 7. Which of the following medications are safe to be administered via a nasogastric tube? Option A, enteric-coated drugs to minimize the impact of gastric irritation. Option B, a cocktail of all medications mixed together to save time and prevent fluid overloading the patient. Option C, any drugs that can be crushed. Option D, drugs that can be absorbed via this route can be crushed and given diluted or dissolved in 10 to 15 milliliters of water. So what is the right answer? Option D is the right answer here. That is, drugs that can be absorbed via this route can be crushed and given diluted or dissolved in 10 to 15 milliliters of water is the right answer. Okay. And so the eighth question is, which check do you need to carry out before setting an enteral feed via a nasogastric tube? Option A, that when flushed with red juice, the red juice can be seen when the tube is aspirated. Option B, that air cannot be heard rushing into the lungs by doing the whoosh test. Option C, that the pH of gastric aspirate is less than 5.5 and the measurement on the NG tube is the same length as the time insertion. Option D is that pH of gastric aspirate is greater than 6.0 and the measurement on the NG tube is the same length as the time insertion. So what's the right answer? You should tell me the right answer. Or no, I'll tell you. Okay? And I wish all of you get the answer right. It's an important question. The answer is option number 3. That is option C. That the pH of gastric aspirate is less than 5.5 and the measurement on the NG tube is the same length as the time insertion. So that is the right answer. Remember it. Okay? Friends, if you had liked my vlog so far, please don't forget or hesitate to take a second to give me a thumbs up. Okay? Question number 9. Fred is going to receive a blood transfusion. How frequently should we do his observations? Option A, temperature and pulse before the blood transfusion begins. then every hour, and at the end of bag or unit. Option B, temperature, pulse, blood pressure, and respiration before the blood transfusion begins, then after 15 minutes, then as indicated in local guidelines, and finally at the end of the bag or the unit. Option C, temperature, pulse, blood pressure, and respiration and urinalysis before the blood transfusion, then at end of bag. Option D, pulse, blood pressure, and respiration every hour and at the end of the bag. So all the options look alike. The right option is option B, that is temperature, pulse, blood pressure, and respiration before the blood transfusion begins, then after 15 minutes, then as indicated in local guidelines, and finally at the end of the bag. Okay, that's it. As we have reached the last question of this session, that's the 10th question, that is approximately how long is the spinal cord in an adult? Option A, 30 centimeter, option B, 45 centimeter, option C, 60 centimeter, and option D, 120 centimeter. What's the right answer? Option B, that is 45 centimeters, is the right answer. Okay. If you have tolerated me for the 10 questions, spare a minute more and give your valuable comment in the comment box. Okay. Wish everyone a super success in the forthcoming exams. Come back with your recent photographs and your location after you have cleared the CBT so that I can flash your name in the coming vlogs. Bye bye. Take care.